Good evening and welcome to the Cancer Education Series brought to you by the Holmes Murphy Foundation. My name is Chris Goodale and I'm the Executive Director of Above and Beyond Cancer. We're glad to have you with us. It's my pleasure to turn the program over to our founder, Dr. Richard Deming. Dr. Deming?
Hi everybody, welcome. You're in for a treat tonight. It's my pleasure to get to introduce our speaker. Our speaker tonight is Greg Fuqua. Greg and I met a couple of years ago. Greg is from Ames. He went to high school in Ames. He then became a Hawkeye, went to the University of Iowa, and his bachelor's degree was in fine arts, a bachelor's of arts in fine art with a specialty in printmaking. And he practiced as an artist for quite some time, but he always had an interest in meaning and purpose and psychology and emotions. And just recently, he got his master's degree in clinical mental health counseling and now is a certified mental health counselor. But he's also still interested in the arts. We got to know each other through a project we did through Drake Community Press, and he taught a course for a whole semester as art as therapy for cancer survivors. Tonight, he's going to expand on some of the work that he's done in both art and mental health counseling, and it's basically about thriving and about using art as therapy at getting at the deeper emotions. So I'm going to turn it over to Greg. Thanks, Greg.
Thank you. Thank you for that wonderful introduction. I'm super happy to be here. I'm going to go ahead and share my screen and get my PowerPoint going for you guys. A lot of my talk is going to be coming from a different angle of understanding healing. And so the talk is called The Need for Expression and the Need for Connection. And I think this is a good way of sort of summarizing what sort of my focus and angle is on healing and as it relates to cancer survivors. Another way of thinking of this is the two basic needs of a developing child. And if you can think of what connection is in a developing child, to be thought of as sort of attachment. And attachment is having a secure and safe and loving bond with primary caregivers. Expression can also be thought of as authenticity. And these are another couple good ways. So to understand that I'm thinking of these terms in a broad way, meaning that we don't have to be an artist in order to find who we are and to find connection to the things we do. So you're going to see some of my artwork in this presentation. And right now you're seeing a really large charcoal drawing that's actually 6 foot in width, that hangs ominously in my living room still, sort of looks down over me. And it was something that I came to at a point where I actually quit making art. And then this sort of came out of it. And so I think it's important to understand that I sort of see myself as a cancer survivor, although I haven't had cancer myself. And so when I was 18 years old, my father was diagnosed with bladder cancer and died very quickly in 9 months after that diagnosis. And at that time, to be honest, I just didn't have the ability to process, to grieve, and to understand that loss. But I know that cancer became a terror as a word in my life. And the week of my father's funeral, my mother was diagnosed with stage 4 breast cancer. And that was so difficult. And she spent the next 10 years fighting 3 different types of cancer and eventually succumbing to it. And so the opportunity to create a program that helps healing for cancer survivors has been tremendously healing for me. And this image behind you was a point in time of where I finally realized that my art was my therapy, and that some things needed to be revisited, needed to come out. And it wasn't long after that, after 23 years of teaching art and working as an artist, that I sat down and thought there's something more here going on with me as a teacher and me as an artist. And I made a list of everything I had been through in my life, everything I had to overcome. And it was a really exhaustive list. And it started from my earliest memories. And then I made another exhaustive list of every possible thing I could be and do in my life. And at the bottom was art therapist and counselor. And that sort of changed the course of my career and my understanding of myself at age 47, which is, so it's been quite a journey for me, and a wonderful thing for me too. I think a good way to think about how I'm going to approach kind of what you're going to see is sort of my philosophy on healing, is to understand my perspective of looking at the body as functioning as a teacher for us, as a warning system for us. And that I see, and I think science is really seeing now, that the immune system function is inseparably tied to healthy emotional expression, and these things go in hand. And so the view I'm working from is healing through social emotional health. So there's been tremendous and building and growing cancer research that looks at the benefits of connection and expression. And I'm going to be going over a lot of that now to make those connections here for you. It's documented that emotional expression, social supports, lower levels of stress, and particularly emotional distress are associated with improved survival times in cancer patients. It's also documented that behaviors of self-sacrifice, of emotional suppression, are often found as traits of patients who have been diagnosed with cancer. One of the big fields that's growing in terms of looking at this dynamic is called Psychoneuro Immunology. It's much easier to say P&I for short. And Psychoneuro Immunology is basically the scientific inquiry of the relationships between our physiology, biological processes, or sort of psychology and biological processes, and the implications of these relationships on our health, and particularly our immune system. Chronic stress significantly affects the function of the immune system, as well as modifies the evolution and the progression of many diseases, as psychosocial interventions have proved to be effective in their therapy. And one person that has really done compelling work in sort of proving some of this is a woman named Professor Kavita Vihara, and she's a medical professor of health psychology at the University of Nottingham. And she did this flu vaccine efficacy study. So she wanted to see if there was compromise in the immune system of highly stressed individuals, and if there was ways of alleviating this through socio-emotional skills and health. So she looked at a highly stressed and vulnerable group of people, which were spousal caregivers of dementia patients. And she took this group and a control group and gave them both the flu vaccine to see what their immune response would be. That means how efficacious in terms of having a fourfold increase of immune response to the virus and being considered effective against that virus. And what they found was that the control group had a 39% efficacy rate, which doesn't seem all that high in itself, but the spousal caregivers of dementia patients who are in a highly stressed situation and also an isolated situation in terms of social support and connection at times, because their partner is part of the sufferer here. Their efficacy rate was 19%. And so, again, she went out to see if there could be an intervention, a non-pharmaceutical intervention that could help with this. And so they gave this same group of folks, not the exact same group, but another group of stress caregivers, an 8-week course in stress coping skills in a group format. So it had the component of connection and sharing, but also building skills in terms of working through stress and connecting with their own emotions and self-awareness. Fairly standard 8-week course. Afterwards, they once again looked at the response and the efficacy of the flu vaccine and found that 19% went up to 50%, which is really dramatic and compelling evidence that our emotional lives are highly tied to our physiology, our endocrine system, the working of our immune system. And what a wonderful thought, you know. And if you understand of the sort of origins of the word healing, it's an Anglo-Saxon word meaning whole or return to wholeness. And it's really important to understand the connections between the brain, our emotions, and our body, and that these are actually one system. There's also other great examples of this, and we can look into the Spontaneous Remission Project. And one example of sort of spontaneous remission is this wonderful book. And also, you can also find her on this TED Talk from Anita Moorjani called Dying to Be Me. And she was a woman who had lymphoma. She had tumors the size of lemons. She had 3 weeks to live in the hospital. At that point in time, she had an out-of-body experience. And in that out-of-body experience, she realized she had lived her life for everyone else except herself, and that she had forgotten about herself in that process. And with that realization, she came back into her body, and within 4 weeks, her cancer was gone, and she left the hospital and it has never returned. And it's an amazing story. And there's many of these. There's thousands of these at the Spontaneous Remission Project, worth taking a look into. Another huge voice as it relates to the connections here between the mind and the body is Dr. Gabor Mate. And I can't recommend enough looking into his book called When the Body Says No. He also is an incredible speaker and talks internationally, and you again can find his lectures on this topic all over the internet and YouTube in particular. He's a neurologist and psychologist who's worked in palliative care units and worked in substance abuse for decades. He says emotional stress is a major cause of physical illness, from cancer to autoimmune conditions and many other chronic diseases. The brain and body systems that process emotions are intimately connected with the hormonal apparatus, the nervous system, and in particular, the immune system. And he says after decades of working in palliative care units, he noticed that it wasn't a coincidence of who was sick, meaning there was more patterns here in terms of personalities and coping styles that you could imagine. And he started sort of putting some of these things together, and does in a very brilliant way through his lectures and in this book of When the Body Says No. He gives one example of an Australian study of 550 women who had lumps of sufficient size to require biopsy to detect cancer. And before they did those results, they gave a psychological interview looking for two different areas in these patients' lives. And one was, they asked, if they had a stressful event in their life recently, and that would look like perhaps somebody close to them died, a major accident, job loss, something like this. They also looked at another factor, which was, were they socially isolated? And so meaning, did they have proper social supports in their life that were close to them that they could use? And what they found was, as they looked at one factor, it had really zero impact on whether that tumor ended up being cancerous or not. They looked at the other part, and it also had a zero impact on whether that tumor was cancerous. When they put both of them together, they realized you had a 9 times higher likely of that tumor being cancerous if you were both socially isolated and had a major stressor in your life. And so what we're looking at there is, did they have a social support network so that they could connect, they could feel secure, they could express whatever they were going through about the stressors in their lives? So you see both these elements of connection and expression are critical to our own wholeness, health, and healing, and may have a big impact on the progression and diagnosis and pathology of disease. Another big voice, Lydia Temesha, and in her pioneer work, she used a combination of interviews, psychometric tests, and other methods to relate the coping styles and psychological adaptation of cancer patients to disease progression. So someone's really looking at this specific area we're talking about. Temesha's conclusions are that emotional suppression and repression is associated with poor outcome in cancer patients. Doesn't seem like a big revelation, but it is. She said that the expression of positive and negative emotions is a consistent quality in survivors. Through transforming behaviors, she conveys that some people with cancer become more expressive, assertive, and self-nurturing. Right? They're becoming more attuned and connected to themselves. She wrote, for survivors, there's often, quote, a fundamental shift in the relationship to self and to the world. By deepening their awareness of inner needs and feelings, and by expanding to make more genuine contact with others, again, expression and connection creates healing between the split of mind and body, and a remarkable improvement in emotional and physical health. And the research goes on and on. 2 more quick ones. UCLA has found that people who have repressive styles tend to be more prone to illness. And this makes a lot of sense. If you're a stressed out individual and you don't have skills to adapt to these situations, right? Your body is under pressure. And your body listens to what's going on in your mind and your brain, and what's going on. And you can't separate the person from their environment, right? So particularly about immune system related diseases such as rheumatoid arthritis, infections, cancers, the concept is of unexpressed anger. If one doesn't let it out, that could have adverse consequences. We see this all the time in the counseling profession. There are rarely people that come into my office, or that come into my now virtual office, that who have severe mental health issues, who don't have some somatic expression of that, and somatic meaning of the body. And so when people have grief, they end up having a lot of stomach problems. In fact, that's what I went through when my dad passed. Is I went to student health, and they couldn't figure out what was wrong with my stomach. We also see heart disease with anger. We see arthritis in stressed and depressed individuals, because cortisol is a stress hormone. It thins the bones, it thins your cartilage, right? So there's direct correlations here. And anecdotally, I see it all the time as a counselor. The Journal of Psychosomatic Research says extreme suppression of anger was the most commonly identified characteristic of 160 breast cancer patients who were given a detailed psychological interview and self-administered questionnaire. Repressing anger magnified exposure to physiological stress, thereby increasing the risk of cancer. And so these are the big takeaways here. And I'll start with William Osler, who is a fairly famous known physician from the turn of the 19th century, the 19th and 20th century, who said, it's much more important to know what sort of patient has a disease than what sort of disease a patient has. And this is exactly what we're speaking to, right? And I think the best doctors, the ones that have the best treatment outcomes, they're often all using the same treatments and techniques and pharmaceuticals, but the ones that have real impact are the ones that understand that it's about the relationship with the patient. That's about caring about the patient. And when that patient feels cared for and they have trust and safety and belief in themselves and their treatment outcomes skyrocket, right? So again, it's about this idea of connection. So these three components that are sort of takeaways of what I'm getting at here is, number one, you can't separate the mind from the body, and you can't separate the person from their environment. But often people do, and even doctors do. Number two, over time, our coping and emotional patterns get reinforced and become rigid parts of the personality and remain unexamined. That is, the way that we've created coping and adaptive patterns, a lot of times between the split and dysfunction in childhood, this tension between attachment and authenticity. These adaptive patterns, these coping patterns, these defense mechanisms, if you will, a lot of times create problems later on in life. They become entrenched, they're unexamined, and they become unhealthy. It's just that simple. And then lastly, we are complex neurobiologic creatures. We are physical, but we're also spiritual, social, and emotional beings. And again, go back to that idea that what healing is about wholeness. And this is essentially kind of what my program's about. And the way this overlaps into therapy to counseling can really be seen through existential psychology, which is the study of the problems of existence. Okay, and these two big pillars that existentialists look at are responsibility and freedom. Okay, and this is about how we find our authentic selves. And we can do that through some of the adversity we find. So post-traumatic growth, meaning we've had a trauma, we've had some adversity, asks us to find meaning through our experiences. And that's what I'm doing in this program as well. But it asks a bigger question, which is, maybe our catastrophes come around as almost like a blessing or as a teaching tool to help us back, point us back to our true self, or to help us further find our true self. If you don't know Viktor Frankl, then you need to know about Viktor Frankl. An amazing man, a survivor of the Holocaust. His whole family was slaughtered, and he made it through, and he thrived afterwards. And God knows we have something to learn from him. If you haven't read his book, which is a pretty short read, but powerful read, called Man's Search for Meaning, highly recommend it. He really speaks to these opportunities in our lives. And he says, between stimulus and response, there is a space. And in that space is our power to choose our response. And in that response lies our growth and our freedom. When we're no longer able to change a situation, we are challenged to change ourselves. That's powerful stuff. And so again, the takeaway here is challenging experiences lead to identification of values, perspective, and opportunities for growth and increased strength, as well as adaptation, flexibility, go on and on. Another big existential psychotherapist is Rollo May. And he came up with this idea of the wounded healer. And he believed that we heal ourselves through our own wounds, through our own challenges, our own adverse life experiences. He thought the best healers, teachers, and artists came from a place of trial and struggle. That these people have a greater understanding and connection to their vulnerability, their complexity, their resources, their humanity, and how to be adaptable, resilient, and creative. And the takeaway here is that creative individuals, they use their struggles to help define themselves and find more meaning to move forward. Let's go back for a moment. So there's really some strong ways that research can help us think about how to be a survivor and a thriver. And it suggests that there are certain qualities that can be learned and developed further and used, and there's bad qualities that can also be minimized, that outcomes can be dictated by some of these things. So the personal qualities associated with a good prognosis include a fighting spirit, positive avoidance. And what's positive avoidance? Positive avoidance is living your life, essentially. It's going out and finding ways to re-engage yourself in positive ways and not letting cancer define you, right? Dr. Demi knows all about this. This is what Above and Beyond Cancer is about. It's about strong, supportive relationships and connection, of the ability to cope effectively and flexibly with stress. Factors associated with poor prognosis is fatalism, right? We need some positive anticipation. We need that belief. Anxiety and depression, for sure. The suppression of emotions, a lifestyle of isolation, right? So lack of expression, lack of connection. And then listen to this one, poor family relationships during childhood. And again, that's where we're starting to look at connection and expression as concepts of attachment and authenticity that come into conflict, meaning I can't be myself because if I do, I may not be accepted, or that threatens my relationship in some way. And so it's some sense of conditional love or invalidation. Lower socioeconomic status and major losses, again, the intensity of trauma and stress on our lives. And we only have to look at the ACEs study, the Adverse Childhood Experiences study, to really dramatically and compellingly see how the traumas in our lives follow us or can follow us around and really affect the impact of our physical health. So clearly there's these psychological stresses that are important to identify. And that's where I'm more focused at. Again, I think this is an area that's too overlooked and too critical to not be part of our healing process. And I'm certainly not saying that there isn't genetics and other environmental factors that we have listed here down below on the right, including nutrition and chemicals and toxins and all these other things that have a factor on disease. And this is not in any way blaming the patient. And that's the last thing I would ever do, because again, there's no purpose here. A lot of these things are unconscious. And from my experience from cancer patients, these are some of the most wonderful people you could meet in terms of generosity, in terms of nurturing, in terms of giving, in terms of empathy. But sometimes in that process, they lose that connection to themselves. And that can be a problem. So to jump into my program, which is how can we learn from the lessons of what art can teach us in terms of connection, in terms of expression. And in my program, it's a 13-week program. It's a group-based program, meaning you're in this together with other people, other cancer survivors, and other people with chronic disease even. I've had an MS person join us. And it was wonderful. Meets once a week for 3 hours, and it has several different components. But the idea here is that through connection and through expression, we can really find validation, support, and healing. Part of what creativity has to teach us is the thinking about it as the opposite of stuckness. And so we see this all the time in counseling, that many people are stuck with having limited alternatives for resolving their issues. And a lot of times our task as counselors is to help free the client to re-see their potential, to facilitate the development of new creative thinking, expansive choices. So stuckness is basically an inelegant but a descriptive term to describe the opposite of intentionality, or a lack of creativity. I think the biggest takeaways in terms of creativity are to embrace not knowing. So learning and growing is not about knowing or understanding. I often have a lot of clients, and I had tons of art students that say, I don't know what to do. I don't know how to get there. And I'm like, let's find it out. Let's allow yourself the space to find it out. Let's give yourself the grace to fail, to experiment, to play without judgment, with curiosity. What a beautiful thing. So learning and growing is not about knowing or understanding. It's about giving ourselves the space for discovery, to be trusting, accepting, and embrace the journey, the process, and not outcomes. So it's about living in a free way. If we look up at the top corner, quote from Erich Fromm, creativity requires the courage to let go of certainties. Because creativity can never be about what you already know. It has to be about pushing into a new potential and a new discovery. And because of that, fear is good. Experiencing doubt's a good sign. It means you're partnering with your creativity and you're growing. And so courage is this twin attribute of fear and vulnerability. And a better way of thinking about fear is having courage in the face of less certainty, or the threat of uncertainty. And then the flow, which is such a huge lesson. And it's a lesson in mindfulness. It's about being in the moment. It's about letting go. It's about being part of this dialogue and this energy that's moving forward, it's about swimming down river suddenly, instead of swimming upriver, instead of fighting it. It's about seeing where this can go and finding new discoveries along the way, losing a sense of self, losing a sense of time. When you're really in it and you're totally connected and immersed in that thing that you're doing, that's a beautiful time and a wonderful way of living. So this is my theory of creativity, because I've had so many students that tell me, I don't know what to do. I don't know where to go. Where do I go next, Gray? And so at some point, I sort of broke through, and I ran up to the chalkboard, and I'm like, okay, this is creativity. And then I want to make sure all you guys know what this is, and to make it clear. And it surrounds this little quote at the top right, which says, we must lose ourselves in order to find ourselves. And you can see how that sort of repeats that same theme of how our catastrophes may have come along to help us re-find ourselves in a new way. So creativity happens in between these two dialectical ends, so to speak. And you can't have creativity in doing things you already know. That wouldn't be creative. That would be doing what I know. So we actually have to push into the space in between the known and the unknown. We have to push into the unknown to make a discovery, right? So I say creativity is this place of tension between acceptance, and we have to start with acceptance. This is what I know, this is who I am, this is where I'm starting, but then of also denial, not just repeating your patterns or being stuck, right? A place of tension between being absolutely comfortable and being absolutely lost. We have to push into new territory, right? And then from predictability, which again is that stuckness in those patterns, those things that we repeat, and towards more chaos or into more chance or into the possibilities of what life can bring and what you can find out, right? So what does the class entail? It entails these 4 components. One is psychoeducation. And we'll talk about what that means. Group talk therapy, which again is that need for connection. Guided meditation and mindfulness practices and art therapy projects. Okay. So with psychoeducation, it's essentially kind of the class lecture. It deals with weekly themes. So each week we have a sort of different theme to sort of talk about and possibly direct our discussion and interaction, and also some of the art projects we do. In addition, there's a journal component to the class. Everyone gets a journal, and there's homework if you choose to do it. So there's a handout with sort of prompts and themes and questions and narratives that you can also explore in your journals, as well as art therapy projects every week. But the class lecture basically deals with these themes, and it's intended to educate, elicit thoughts, emotions, inspiration, sharing, and discussion. People bring in their journals and share too. And some of these weekly class themes: acceptance, resilience, the body is a really big one, thriving, courage, control, awakenings, trust, inspiration, love are all themes that we deal with in the class. And then there's the group talk therapy component. And I would say that this part of the class is the one thing that, in terms of polling, that the class finds most impactful and most positively impactful is the connection. And the people I've had in class are now friends for life, and maybe even family for life. You could more think about it. So at the bottom, I say studies have indicated, again, more research on this, a direct beneficial effect of social support on cancer survival time. The first and most publicized study of Spiegel et al. Showed at a 10-year follow-up, there was a statistically significant survival advantage for women with breast cancer who had participated in group therapy treatment. And there's no doubt that my own clients would echo this. And there's actually some very striking things that have happened in terms of people's prognosis during the class that have been really inspiring. Being able to feel safe with other people is probably the single most important aspect of mental health. Safe connections are fundamental to meaning and satisfying lives. Mindfulness practices are really overlap into art making in general, but being more intentional about slowing down and connecting with ourselves is something that I really try to foster in the class, and something that we do in some of our art projects too. So we often do a sort of an arrival meditation where we sort of quickly sort of check in on ourselves. Sometimes we draw it, sometimes we just sit quietly, and then a lot of times the group awakens. And then, of course, there's art therapy projects. And without going into the panels on the left, the picture says enough about kind of what happens for people. And in the scramble of our brains and our emotions, you're able to finally process through by opening up sort of different parts of the brain and more wholeness in the brain, and getting validation, acceptance for wherever you are. And in our art therapy project components, we have a mural component we do as a group, and there's group and individual projects. There's also a third of the class that is spent in a clay studio where we do wheel throwing and clay building and more sort of getting our hands dirty in the muds, the stuff that connects more to our senses. And much of the theme there is our bodies. So what does art teach? Well, I think we've already gone over a lot of it, but basically it's the challenge to discover more of ourselves, to be more self-compassionate and accepting of who we are and what we're going through, to be self-aware and to be inspired, to draw upon our attributes and to draw upon experiences, good or bad, and our strengths. And just to sort of use what we have, to find meaning and connection in ourselves and the things we do. This is my definition of art. It's a very broad definition. Can we find ourselves and have an intimate connection to the things we do? We are being artists. To be creative, to move forward. And it teaches us also how to just live, grow, and thrive. Again, to go back to Bessel van der Kolk, critical to the quality of our lives, our imagination enables us to leave our routine everyday existence by play and fantasy. All the things that make life interesting. Imagination gives us the opportunity to envision new possibilities. It's an essential launch pad for making our hopes come true. It fires our creativity, relieves our boredom, alleviates our pain, enhances our pleasure, enriches the most intimate relationships. Some examples of stuff I've done and these are from my art class. And right off the bat as a teacher, I started doing a lot of interactive, collaborative process and also very expressive oriented processes and exercises with my art students. And I had students running up to me and going, Greg, oh my God, this is incredible. You need to go into art therapy. And I was like, yeah, haha, thanks for that. And then 25 years later, I'm like, okay, you were right. And I wasn't there yet, which is okay. But it's neat to sort of have that insight given to you early on by your own students. And in fact, it was a former student at Drake that started working as an intern at the Drake Community Press when they were looking for somebody to create an art program with Above and Beyond Cancer for certain cancer survivors. That she said, oh, I know just the person. I don't even know if she knew I was going into counseling at that time, but what an incredible serendipity of events there. Anyhow, so these expressive exercises, sometimes we pick a theme or an emotion or an adverb or an adjective to think about how that changes our energy, that changes our approach, that changes our perception of things around us. And so these are just still lives. But the still lives end up being about the theme, right? Direct connection to emotional expression. We have two examples on the left and right, and you can make your own guesstimations of what the emotions here are, and it's worth thinking about, and if it's coming across. And then the middle one is an art therapy exercise I've done with a diagnosed PTSD survivor, and she had incredible pain and darkness that you can see in that sort of red and black area at the bottom. And then she had these protective and soothing mechanisms that you can see are sort of overlapping and sort of rocking and swirling back and forth as we went through the process of revisiting some things. This is when she went back and forth to. And this woman is an incredible artist, actually. And she did this whole process with her eyes closed. A lot of these processes I do share and encourage my art students to do. And a lot of them, for instance, at Grandview, we're going through the art therapy certification program, or we're in psychology already. And I never forced anybody to do these, but the ones that did, I think, found some important avenues for healthy expression. This was turned into my portfolio at the end of a semester from one of my students that had this narrative next to it. I've recently quit my job I've held for over 3 years now. I was underappreciated when I broke my back, dismissed when I should have been thanked. I've put up with enough at this company. I shouldn't have expected much. I broke down myself mentally and physically, and I only feel remorse and guilt for quitting something that was killing me. I wanted to feel free, but instead I feel ashamed and useless. The blue is what I want to feel, free and beautiful. Instead, I'm like the black, enclosed and ripped apart and dying. The mural project, oh my God, was this something? In my first artist therapy for cancer survivors program, I gave them a giant sheet of paper and said, I want you guys to come together and think about your theme and think about who you are and think about what this process has been through. And this idea of individual parts fitting together, being connected as a puzzle, I think was really powerful. And in each person had their space. One person who no longer was able to come to the class had their own space, that orange space in the bottom middle. And then words of affirmation of her personality and strength. And that piece was still dedicated to her that everybody contributed to. Every space has a story and a meaning, and some of them a direct connection to their diagnosis. That's really powerful. That's really personal. That's also really healing and a wonderful image of how they came together and who they were. On the right is one of our body exercises where I had life-size pieces of paper pinned up against the wall, and the participants, many of them would have somebody else trace their body on the paper and then work through these body exercises, thinking about what they've been through, creating narratives, writing out, journaling, getting out their feelings, refriending their body, reconnecting to what they've been through. It was a super powerful exercise. And again, a lot of the stuff we did in the journals was about words too. You don't have to be an artist to find expression and healing. You can find it through words. You can find it through so many different avenues. And we had plenty of people that were not artists, but still they dove in or they did their own thing and they found themselves. They found a connection to their story in some way, shape, or form. These are some simple exercises that I won't go over right now, but know that this PowerPoint is you are welcome to have. And they entail a couple exercises, some of which you've seen examples of in here. And I'd be happy to send that out to whoever would like it. So please feel free to reach out to me. The two questions I want you guys to reflect on before you give me any questions. So you can see this is a good way to sort of stymie you. No, just kidding. Really connect into important reflections. And number one, where in your life do you need to more often say no? Or maybe to say yes? Number two, where in your life do you suppress, self-sacrifice, or feel the most conflicted? Because I think these are the big areas we find as entrenched patterns that create additional stress, that create patterns of self-sacrifice, that fight against our own ability to heal and our bodies to work to heal ourselves and to protect ourselves. And then, if you were to answer those, what impact does this have on your ability to honor your authentic self your emotions. And here's really what's important is, where do you feel this in your body? Because a lot of this is sourced in the body. And I work somatically with a lot of my clients, and I have a client who went through a lot of emotional abuse when she was younger, and she found a way to cower, not be seen, to avoid it. And guess where all of her stress is still located as an adult? It's all in her shoulders and all in her upper back, right? She's still carrying that with her. It's still expressed in her body, her trauma. And so also, then what does this have to tell you about the story of your life and your own physical ailments? And then more resources. Start looking into examples that connect art with healing. And so here's some great TED Talks, some of which I've already mentioned in the talk, but great resources for you to take a look at. And there's plenty out there. There's plenty to be inspired by. And so, again, let me know if you do have questions or thoughts, or feel inspired. I want to connect with you in any way I can. And please let me know if I can share this PowerPoint with you. Thank you.
Greg, that was really good. I appreciate all that you had to say. The post-traumatic growth, I wonder if that's something that we don't talk enough about, maybe. Post-traumatic stress is something that we hear more about. So that's really sort of a positive way of looking at the same thing that happened to the person, right?
Yeah, I think the best way to conceptualize even PTSD is to understand that these people are essentially over adapted. And so you have to think of it in sort of, this sort of positive skew. And I often tell people, you're not voluntarily this way. You have been incredibly adaptive to how you needed to survive what you did. And now this stuff still resides in you and feels like it's sort of overtaken you. But in some ways, it really speaks to our resilience and our strengths. And, to help survivors understand that resources inside them that have yet to be undiscovered are there, and that there can be tremendous advantages to the strength and to our understanding of our potentials and ourselves through the adversities we faced, even though they feel like they're the things that really crush us, but also, when we can overcome them, the things that make us incredibly successful.
Mm-hmm. Well, and we talk a lot about mind, body, spirit in Above and Beyond Cancer activities, and this is right in that same path of how we're all going to be more healthy wherever we are in our cancer journey, or if we're care providers, that if we do a better job of taking care of ourselves, we're going to be better people in the long run and better partners, and we're going to have sort of a leg up on those who unfortunately just can't seem to get the positive part of it.
Yeah, it's very true. It's really an honor to be part of this Above and Beyond Cancer. And I feel like it's a wonderful fit for, the themes you guys promote. And it's wonderful to be a part of that, and to find healing, growth, and connection through this process. It's a wonderful thing.
Well, as I said, I think you did an excellent job of laying out your sources, and it helped me to better understand where all this comes from. I think the thing that strikes me the most is the deep historical nature of what you talked about. I mean, it just goes way back.
So true. It's so true. It really does. And it's kind of weird to think about that. In some ways, we're finally catching up and understanding how important alternative methods of healing are, things that we've overlooked in the past that now become powerful avenues to pursue, that really have been there for a long time. And I think people know a lot of this through their own experience and anecdotes too. I mean, they know that when a couple that's been together for 50 years and one of them gets sick and goes to the hospital, everyone knows what often happens to the other one. Mm-hmm. And that other partner often gets sick or often dies when the other one does. And so we know there's powerful connections between the emotions, our mind, our bodies, our spirits, and that to understand healing best is to understand it as a sort of a whole system.
Yeah, it's powerful and yet pretty simple in so many ways.
Isn't it? It's like, how do we overlook this, folks? But that's what's great about having a voice and a program to put that back out there and to help people reconnect in some different ways and having a different angle on it. And so I appreciate really being here and sharing my thoughts and my philosophy.
Well, as I said, excellent work, and we'll do this cancer education series again next week, and Alex Kennison from MercyOne is going to be our guest then. So Greg, thanks very much, and we'll continue to enjoy working together with you down the road.
Thank you so much. I really appreciate it.
All right.
Good night, all.
Hey, thanks.